I've done a lot of international work as a surgeon. Thankfully, I've been lucky that way. I've worked in Ukraine, I've worked in Haiti, I've worked in other conflict areas, but but Gaza is something quite different. And I've been involved in the Arab-Israeli conflict since I was 18. The Second Intifada broke out when I was in college. So it was just something that I ended up sticking with throughout my life. But, Gaza, the attack on healthcare in Gaza is something unique in history and literally in world history, as far as I can tell. And so I think that the fact that I provide some protection to my colleagues and to the hospitals when I'm there is a major reason that I go. But also just the need of obviously the need for a trauma surgeon there is tremendous. But really, it's to stand in solidarity with my colleagues who I know are just under direct attack.
What do you mean when you say you offer them some protection? What does that mean exactly?
Well, I mean, I know full well that the Israelis can kill me and get away with it, and the U.S. administration, Biden or Trump, doesn't really matter, just won't care. But nevertheless, it would be a media headache, and I've written a New York Times article about Gaza. I've written a Politico article. I've been on CNN and ABC and things like that. So I have some mainstream credentials, if you will, and and it would be embarrassing for them to kill me. They get, honestly, they were about 2 minutes away from killing me on March 23rd. If I hadn't been pulled into the ICU, or if they had attacked Nasser. They bombed Nasser Medical Complex on March 23rd when I was there and killed one of my patients. But nevertheless, I think they would probably rather not kill me. So, maybe they used a smaller munition when they attacked the hospital. Maybe they, I don't know. But I think that I hope that my presence makes them more hesitant to attack the hospital that I'm working at when I'm there.